Chamisa, you are an expert in endoscopy. Can you explain to us in simple language for the layman to understand what is endoscopy?
Thank you, Marcelo. So endoscopy means examination of the digestive system using a telescope. So basically this is a long, thin instrument composed of a light source, a camera, and what we do, we insert the telescope through the digestive tract to examine either the upper system or the lower system. And there are two types of endoscopy. There is what's called upper endoscopy, called gastroscopy, and also a lower endoscopy, also called a colonoscopy. So that's the most common scopes we do in our practice.
Can you tell us more about upper endoscopy and how it is done?
Upper endoscopy, the other name, as I say, is called a gastroscopy. So this means examination of the upper digestive system using a telescope. And this is an office-based procedure where we do give patients some kind of sedation, and so they'll be comfortable and pain-free. And we insert the telescope through the mouth, down the food pipe, into the stomach, and the small intestine, looking for the cause of their symptoms. It takes about 10 to 20 minutes to be done.
Which kind of patients do you commonly advise to have an upper endoscopy?
So most patients who have symptoms or complaints affecting the upper GIT system, which include patients with possible stomach ulcers and patients who have problems with swallowing or pain swallowing, and only patients who have history of chronic abdominal pains needs to go for upper endoscopy. And any patient with a history of a suspicious cancer of the stomach also needs an upper GI endoscopy. So I would say any patients who have non-specific complaints of the upper GIT system must go for upper endoscopy. And other common symptoms include patients with heartburn or reflux symptoms. That also needs an endoscopy to examine the esophagus and the stomach for either ulcers or even more serious conditions like cancer of the esophagus. So all this needs to be investigated.
What is the lower endoscopy or colonoscopy and how is it done?
Lower endoscopy or colonoscopy is the examination of the lower digestive system using a telescope. And again, this is an office-based procedure where patients are given sedation to be comfortable. And we do insert a telescope through the anus, the rectum, right through the whole colon to look for the cause of their symptoms. And it's about 20 minutes procedure to be done in the rooms, and there is no major side effects or complications.
And which patients would you advise to come for colonoscopy?
Well, the most common reason for colonoscopy is to screen for underlying colon cancers. So any patients with symptoms like rectal bleeding, chronic constipation or diarrhea needs to be checked for any possible causes in the colon. And also patients with symptoms like a loss of gas or bloating in the abdomen needs to be checked in the colon. But the most common reason is to exclude major diseases like colon cancers.
You mentioned that you do colonoscopy for patients with suspected colon cancer. What are the common symptoms for colon cancer which patients present you with, and what should they watch out for?
The most common symptom for colon cancer is rectal bleeding. And any patient with history of bleeding must be checked to check where the problem is coming from. So bleeding is the most common symptom of colon cancers. Besides rectal bleeding, some patients do come in complaining of a non-specific symptoms like flatulence, loss of gas, bloating, or unexplained loss of weight. And also any patient with a low iron level or what we call anemia needs to be checked for any possible colon problems. But any history of bleeding must be checked. Lastly, any history of cancer in the family also, they need to be checked for colon cancers as a screening test for colon cancers.